CPM program has been facilitated through Auburn University Montgomery for nearly 30 years now. Each program is really designed to strengthen the leadership development of current and future managers who've devoted their careers to serving in the public sector. And we're very proud of the fact that Alabama's CPM program is really known as a model program among other states. One of the main reasons that Alabama's program is seen as a model for other states is because of the capstone project that we call Solutions Alabama. This capstone project is where participants who are in the CPM program, and they represent a number of agencies across the state, it's where they work to identify and research and analyze and even offer recommendations to some really important and sometimes critical issues that impact our state. Over the years, there have been about 40 or more topics that have been explored by CPM participants. And again, we're really excited to present 4 topics to you this morning. The topics that you'll hear about in just a moment are related to food deserts in Alabama, liquor distribution in Alabama, foster care in Alabama, and caring for Alabama's elderly. These were 4 topics that our current class of CPM participants were highly interested in. The research in these topics, the findings, and even the recommendations do not represent any agency or organization, but rather the findings, the research, and the recommendations come from the educational research of the participants who are in the CPM program. So we're excited to share those findings and those recommendations with you this morning. As we begin our presentation this morning, I'd like to thank a few key organizations and individuals. First of all, I'd like to say thank you to the class members themselves. There are 27 CPM participants in the program that are graduating this year, and they represent 12 different agencies across the state. They have pursued this work of researching these topics through the many disruptions that we've all faced through the pandemic. And they are some of our state's finest leaders. I couldn't be more proud of them and the work they do to make our state better. So I thank those 27 participants in the CPM class this year. There's no doubt that many of you who are watching today are likely the supervisors of some of these class members. We likely have some of you who are serving as commissioners, deputy commissioners, HR leaders, and I certainly want to say thank you for your investment into the lives of these managers who desire to make a difference for their state. So thank you for your continual support of the CPM program. Also, I'd like to say thank you to a number of individuals and agencies and organizations who really opened up their doors, shared data for our teams, shared their experiences along the way to guide our team's effort as they pursued learning about these topics. We really appreciate those key stakeholders for collaborating with our teams to help them and assist them in this learning process. So we thank you for those individuals who've been a part of this effort this year. And finally, last but not least, certainly want to say thank you again to our Chancellor, Dr. Carl Stockton, and Dr. Murilo Varma as well, the Provost of AUM, for the continual support that they provide to the CPM program, as well as other leaders within AUM. And finally, last but not least, again, thank you for joining us in this webinar today. We appreciate all of your support. So without further delay.
Hey, Neil, this is Dr. Stockton. I'm back on. I'm sorry to interrupt you.
Good, wonderful, Dr. Stockton. Thank you for joining again.
Would you like me to say something or go on?
Please do, Dr. Stockton.
Okay.
Sorry for the technical difficulty we had, but yes, please share some remarks if you would.
Sure. I apologize to everybody. We had a big power failure on campus. Alabama Power's coming out, so our whole internet is is down, so I'm logging in on a laptop with a cell phone and a hotspot. So thank you for allowing me to kind of be back on. Let me just tell everybody that, as I was saying, that I'd like to thank everybody for their participation in the CPM program, and wanted to let everybody know that today, if Neil, if you hadn't already said it, today is a special day, September 11th, 19 years ago. And I just want everybody to remember those folks that gave up their lives and their families almost 20 years ago for September 11th. Again, I want to congratulate everybody for their hard work on the CPM program. I was looking at some of the topics, the caring for the elderly, which is very, very important. As I think about my own self, I turned 62 this year, so I'm not far from catching up with elderly, and so I think it's a very important topic. The food deserts, when I first saw it, I thought food deserts. That sounds like an interesting topic, but there's a lot of people that are very hungry and need help. We have a food pantry here on our campus as well, that a lot of our students need that kind of support as well. The one that intrigued me was the liquor distribution, and so I'll be interested to see how that's presented. And obviously, finally, the foster care topic is very, very important. I learned quite a bit. I serve on the Child Protect Board here in Montgomery, and so there's definitely a big need for supporting children in foster care. So with that, I'm not going to say much more except to all the participants, congratulations. Have a great meeting, and we're very proud of you, and Neil, we're proud of you and supporting the program, and we look forward to supporting this program in years to come. So thank you for your time, and have a great meeting.
Great, great. Thank you again, Dr. Stockton. We appreciate you. So we're excited to begin our presentations this morning. We'd like to begin with presenting on the topic of food deserts in Alabama.
Good morning. My name is LaShonda Knox, and I am a program analyst senior with the Alabama Department of Corrections and a member of the Food Deserts in Alabama team. I would like to thank each of you for tuning into our Solutions Alabama webinar. On behalf of the Food Deserts team, I would like to extend a special thanks to our subject matter experts, John Hilliard of the Birmingham City Council, Danielle Turk of the Alabama Department of Education, and Elizabeth Wicks of the Community Food Bank of Central Alabama. Today, I will present to you our findings and recommendations regarding food deserts in the state of Alabama. At this time, I would like to acknowledge the members of our team. Ashley Owens, Alabama Correctional Industries. Sean LeGrone, Alabama Department of Environmental Management. Susan Smith, Alabama Department of Labor. Margaret Hawkins, Kids First Awareness. And Tanaya Duncan, Retirement Systems of Alabama. The Food Deserts team was tasked to research the impact of food deserts on Alabama citizens and to develop recommendations to mitigate those impacts. I would like for you to take a moment and consider the following scenarios. What if you did not drive or own a car and the nearest grocery store was miles away from your home? What if the only nutritious meal that your children received was at school? What if a low income prevented you from purchasing healthy food for your family? These are problems that Alabamians who live in food deserts face on a daily basis. So what is a food desert? A food desert is classified as a geographical area where residents do not have access to affordable, healthy food. Just a moment, please. We're having a technical difficulty. All right. Many of Alabama's citizens live in a food desert. As you can see from this map, food deserts are prevalent in the Black Belt region of the state, as well as metropolitan areas such as Birmingham, Montgomery, and Mobile. Alabama has a population of 4.9 million people. Of that number, almost 2 million people live in a food desert, and almost 500,000 of those are children. People who live in food deserts tend to have lower income, lower levels of education, and higher levels of unemployment. There are several barriers that prevent our citizens from accessing healthy foods. They are the lack of grocery stores, transportation limitations, and limited income. Many Alabama communities have experienced the loss of a grocery store. Over the last decade or so, we have seen the closure of stores such as Bruno's, Food World, and Winn-Dixie throughout the state. A grocery store will leave an area because of income loss and/or population loss, which could be indicators that a grocery store cannot be profitable in that area. Also, grocers are hesitant to build in urban areas because of the expense and the scarcity of land. Therefore, people who live in these underserved areas are left with few options to purchase affordable, healthy food. Our next barrier is limited transportation. Some Alabamians do not drive or own a car, and many live in areas that do not offer public transportation. And for those areas that do offer public transportation, the routes or the timing of those routes make it difficult for those who utilize public transit to make it to a grocery store. Therefore, the lack of reliable transportation, coupled with the lack of grocery stores, force residents to purchase unhealthy food in nearby places, such as convenience stores, dollar stores, and fast food restaurants. Our last barrier is limited income. Alabama is the 5th poorest state in the nation. 16.8% of Alabamians live below the federal poverty level, and according to the U.S. Census Bureau, most of those lower income residents also live in a food desert. Now, studies show that healthier food options tend to be more expensive. Therefore, those with lower income will purchase food that is affordable to them, but also unhealthy. This food is usually processed in nature and contains high levels of salt, fat, and sugar. Food deserts have a negative impact on the health of our citizens and contribute largely to the obesity epidemic and the occurrence of chronic disease. Research shows that people who live in food deserts are at increased risk of developing type 2 diabetes, obesity, and cardiovascular disease. For Alabama, where almost 40% of Alabamians live in a food desert, the statistics are alarming. Alabama has the highest rate of adult onset diabetes in the country. The #1 cause of death in Alabama is heart disease, and Alabama ranks #2 in the nation in heart disease deaths. Alabama has the 6th highest rate of obesity in the nation. 36.2% of Alabama adults are obese, and Alabama ranks 3rd in the nation and obesity among high school students. Now, Alabama leaders have recognized that food deserts in this state needs to be addressed. Initiatives have already been put forth to address the impact of food deserts. Some of these initiatives are the Farm to School program, Mobile Food Market, and the Alabama Healthy Food Financing Act. The Farm to School program is a program that is administered in Alabama schools that give farmers an opportunity to not only sell their produce, but to encourage students to consume healthier fruits and vegetables. The Farm to School program also offers nutritional and agricultural education for the students. A mobile food market is simply a grocery store on wheels. The corner market was opened in 2017 by the Community Food Bank of Central Alabama in the Jefferson County area. The corner market serves low-income citizens, the disabled, and the elderly who live in areas that lack a grocery store. Also, the corner market offers other services such as health screenings and information on SNAP food benefits. The Alabama Healthy Food Financing Act was passed by the Alabama legislature in 2015 to incentivize grocers to build more grocery stores in underserved areas and to offer healthier food in those grocery stores. It also incentivizes grocers to offer healthier options in their existing stores. Based on our research, our team proposes the following recommendations to combat food deserts in this state. Our first recommendation is to expand the farm to school programs. Currently, 31% of Alabama's school systems participate in the farm to school program. We would like to see this number increase so that more students can have an opportunity to benefit from the education that the farm to school program offers. Also, school districts that participate in the farm to school programs report benefits such as improved community involvement and improved health. As students who participate in the program learn healthy habits that they then pass on to their families and friends. Our next recommendation is to expand the accessibility of mobile food markets. Mobile food markets tend to be successful, as we see with the corner market in Jefferson County. We would like to see a proliferation of these mobile food markets throughout the state so that citizens who live in food deserts will have an opportunity to purchase food that is affordable and healthy. We would also like to see increased marketing of these mobile food markets, perhaps through the distribution of flyers, through email or text alerts, so that citizens will know when and where a mobile food market is in their area. Next, we recommend that transportation routes for public transportation be redesigned. We would like to see grocery stores included on our public transportation routes. And we would also like to see the times expanded on these routes so that people who work odd shifts, students who go to school late or whatever, can have an opportunity to go to the grocery store on their off time. And we would also like to see public transportation offer dedicated trips to grocery stores for our lower income citizens. And finally, we recommend the establishment of municipally owned grocery stores. Now, a municipally owned grocery store is a store that is owned and operated by a town or a city. The St. Paul Supermarket in St. Paul, Kansas, and the Baldwin Market in Baldwin, Florida, are two examples of successful city-owned grocery stores. Both of these cities had lost their grocery stores and had gone for several years without a local grocer in the area. The leaders of these cities realized that there was a need to provide a grocery store for their citizens, and they determined that opening and operating a grocery store, much like offering water to their citizens, would serve the public good. Now, establishing a city or town-owned grocery store is a novel, out-of-the-box concept, but we feel that it's one that Alabama cities and towns should consider to fill their grocery store gaps. In closing, although we've seen several initiatives implemented to combat food deserts in this state, more can be done. Our recommendations will help combat the effects of food deserts, and it will help Alabama become a healthier state and improve the well-being of her citizens. If you would like more information on food deserts in Alabama, please visit the CPM Solutions Alabama website to read our white paper. Again, thank you for joining us in this webinar. Thank you for your time and thank you for your attention.
Let me know when you're ready.
Good morning. My name is Sylvester Williamson, and I work for the Alabama Department of Revenue. Our CPM Solutions Alabama topic was distribution of liquor in Alabama. At this time, I would like to acknowledge our team members. From the Department of Corrections, Tamara Rogers. From the Department of Labor, Sandy Brothers. From the Department of Revenue, Ronnie Harris and Cache Stanford. From the Retirement Systems of Alabama, Jessica Owens. From the Secretary of State, Shamiqua Farrow and Stephanie Kaiton. Our Solutions Alabama team was tasked with examining the history and economic impact of Alabama's liquor distribution model for the citizens of Alabama in comparison to its neighboring states, and providing recommendations for strategies to improve the positive impact that it has. In this process, we interviewed multiple subject matter experts and stakeholders, as well as conducted our own research and analysis. Just to provide a bit of history on the alcohol laws in the United States, in 1919, with the passage of the 18th Amendment, the manufacturing, transportation, selling, and distribution of alcohol was outlawed. The purpose of prohibition was to eliminate things that society considered would be to the result of alcohol. Problems such as violence, accidents in the workplace, and even husbands spending their income on alcohol were all considered societal ills that were blamed on the consumption of alcohol. Even though prohibition outlawed the sale and production of alcohol, it did not end the consumption. As a result of this, illegal moonshine stills were built across the states. Because these moonshine stills were not regulated, the products of these stills often contain harmful chemicals that sometimes cause blindness, paralysis, and even death. Instead of improving morale, prohibition created problems such as smuggling, bootlegging, deaths, and even corrupt politicians and law enforcement. The law deprived the states of revenues from tax and sales of alcohol, while increasing the cost of enforcing these laws. So with the passage of the 21st Amendment in 1933, it repealed the 18th Amendment, thus ending prohibition. The federal government relinquished its control of alcohol and gave the states the ability to regulate. In 1937, Alabama passed the Alabama Beverage Control Act, which prohibited transactions involving alcohol except through the board. It created the ABC board with the purpose of protecting the citizens of Alabama by regulating alcohol. Since the states were now in charge of regulating alcohol within their borders, they were allowed to choose how to do so. The states adopted what are called control models, which I'll describe now. A license model is a model in which the state simply licenses the organizations that are involved in the selling of alcohol. There are 3 tiers of these organizations. There are manufacturers, wholesalers, and retailers. A control model is a model in which, in addition to the licensing, the state controls the wholesale distribution of alcohol. There's a third model called a hybrid control model. In a hybrid control model, in addition to the wholesale distribution and licensing, the state controls the retail sales of alcohol. In the US, there are 17 control states, and 13 of these states are hybrid. In conducting our analysis, we looked at neighboring states and compared their alcohol models to Alabama's. Tennessee operates a license model. In Tennessee, licensed retailers purchase their product from licensed wholesalers. Licensed wholesalers purchase their product from licensed manufacturers, but neither manufacturers nor wholesalers can sell their product to consumers. Tennessee's control model generates revenues through the issuances of these licenses as well as alcohol taxes. For fiscal year 2018, Tennessee generated revenue of over $203 million with a revenue per capita of over $30. Next, we looked at Mississippi. Mississippi operates a control model in which it controls the wholesale distribution of alcohol. In Mississippi, revenues are generated from the wholesale markup on alcohol, as well as the issuances of licenses and alcohol taxes. For fiscal year 2018, Mississippi generated revenues of over $114 million, with a revenue per capita of over $38. Like Tennessee, Georgia operates a license model. Revenues in Georgia are generated from the issuances of these licenses as well as the collection of alcohol taxes. For fiscal year 2018, Georgia generated revenue of over $195 million and a revenue per capita of over $18. Finally, we looked at Alabama. Alabama operates a hybrid model where they control the wholesale distribution as well as the retail sales. Alabama does allow private businesses to sell at retail, and it licenses these businesses. Alabama's model generates revenue from both the wholesale and retail markup of alcohol, as well as the issuances of licenses and the collection of alcohol taxes. For fiscal year 2018, Alabama generated revenue of over $263 million and a revenue per capita of over $53. As you can see here, for fiscal year 2018, Alabama generated significantly more revenue than any of its neighboring states. Alabama also had a much higher revenue per capita than these neighboring states. As we have all had to change our routines and ways of life since the onset of COVID, so has the ABC Board. In a means to reduce the spread of coronavirus, certain types of businesses had their business operations restricted. 2 of these types of businesses are bars and restaurants. Bars and restaurants were prohibited from allowing customers on premises consuming food and alcohol. In an effort to reduce the economic stress that this restriction caused these types of businesses, in March of this year, ABC issued an emergency order that allowed bars and restaurants to sell sealed containers of alcohol, beer, and wine to customers for all-premises consumption. This created a new stream of revenue that these businesses did not previously have. In July, this order was extended through September 15th. As you can see here, in a comparison of liquor sales from March 2019 to 2020, there was an 11% increase. This is possibly due to stay-at-home orders and COVID. As our team examined liquor distribution in Alabama in comparison to neighbor states and through interviewing subject matter experts and research, we determined the profitability and responsible distribution of liquor benefits to citizens across the state. When comparing Alabama's liquor control model to neighboring states, it produced the highest revenue, both total revenue and revenue per capita. Alabama has proven that since Prohibition, the current model continues to work. I would like to thank everybody who contributed to this project and thank all of you for taking the time to attend. If you would like to learn more, please visit our CPM Solutions website and read our white paper. Thank you.
Good morning. My name is Scott Champion, and I work with the Alabama Department of Revenue. Our team was tasked with the topic of foster care in Alabama, and we would like to thank you at this time for joining us, and we would like to extend a special thanks to the various organizations and foster families who assisted us throughout this project. I would now like to take the opportunity to introduce the rest of the foster care in Alabama team. From the Alabama Department of Corrections, we have Latrice Green. From the Alabama Department of Insurance, Sherry Jones. From the Alabama Department of Labor, Guana Hunter. And from the Retirement Systems of Alabama, Caitlin Allen and Kiva Culpepper. Foster care is a short-term service provided by the states to the children who are not able to live with their families. The Alabama foster care system is one of 53 similar systems in the United States and its territories, and is also a subsystem of the Federal Children's Bureau, which oversees the operations of the nation's foster care system. Alabama currently has over 6,300 children in foster care, and a child spends on average 618 days, and there are currently approximately 2,300 foster homes available. This equates to 4 children in each foster home for an average of 2 years. The foster care in Alabama team was tasked with researching the resources and services that Alabama provides to foster children, the services other states provide foster children, and for making recommendations to help improve the foster care system in Alabama. As such, the team has developed the following project statement. We will research Alabama's foster care system as well as other states' processes in order to improve foster care for children in Alabama. To give insight on the current state of Alabama foster care, our team researched the Alabama Department of Human Resources at the state and county level, child placement agencies, advocacy organizations, and we also learned best strategies from other states. The purpose of the State Department of Human Resources is to promote a unified development of welfare activities and welfare agencies of the state and the local governments so that each agency and each governmental institution shall function as an integral part of a general system. The county department serves as agents of the State Department by taking responsibility for the safety needs of the citizens within their county through the powers, duties, and responsibilities that are set forth by the State Department. And these powers, duties, and responsibilities are referred to as minimum standards, which is a federal requirement in accordance with the Child Care Act of 1971. Foster families, placement agencies, and social workers all have minimum standards requirements in order to stay within state policy. Alabama DHR has many state level programs to assist foster children. One such program is the Alabama Kinship Navigator. This program is a website designed for information and referral services for grandparents, relatives, and other caregivers who are currently raising a child. Another program is the Independent Living Program. The purpose of this program is to better help transition foster children into adulthood. And we also have the Fostering Hope Scholarship Program. And this was developed as an investment in Alabama's youth, and it covers the cost of post-secondary education for children in foster care and is also available to children who are adopted out of foster care from age 14 and older. Alabama currently consists of 67 county departments of human resources, and these county departments are individually run by a different director and board of directors than at the state level. The county offices have flexibility in their operations as long as the minimum standards are maintained, but this flexibility can lead to inconsistencies in services provided from county to county. While this is not a problem, it can confuse foster parents on what to expect outside of the minimum standards. Another facet of foster care is child placement agencies. Child placement agencies are a private foster care agency that are licensed by DHR in order to provide services in conjunction with the State Department's foster program. They play the role of liaison between the family and DHR. These agencies are independently financed and they help to communicate the needs of the community in order to recruit foster homes and obtain financial resources. While child placement agencies work closely with DHR, advocacy organizations support foster families and provide additional resources to the foster child and family. Because these organizations have experience working with foster care systems, they can often assist in explaining the DHR policies and procedures to the foster families. Most advocacy organizations are nonprofit and community organized entities that are started by an individual or a group that recognizes a need in the community. They fill the need of the foster families who may find it difficult to obtain resources. The Partnership of Child Welfare is partially public, which is paid by public funds, and partially private, which is paid by the families providing the care. DHR, child placement agencies, and advocacy organizations can only be successful when acting in cooperation with the community. Community involvement manifests itself in church and civic activities such as food drives, clothing drives, fun days, and local business sponsorships. In some communities, involvement is high, and in other communities, involvement is moderate to low. Communication appears to be the key. If the community knows what is needed and knows the full range of programs and resources that are available to the state and county, then the community is in a better position to respond and support the needs of the foster children in Alabama. Research shows that there is a need for new foster homes. In fiscal year 2015, there was reported 1,484 new foster homes. In fiscal year 2016, that number dropped to 1,124. And by 2017, that number dropped to a mere 524. The foster care in Alabama team explored strategies that are used by other states, and we would like to take a moment to highlight some of those strategies. Arizona currently offers an expanded resource guide, and it offers county-specific organization directory and provides a list of services offered by organizations aiding the state foster care. Texas has created a health passport, which is a computer-based system that contains medical information that follows each child wherever they go. While it does not contain a full medical record, it does give information on diagnoses, gaps in care, doctor's appointments, prescriptions, and shot records, and it can be provided to the youth as they exit care at age 18. Washington State recently instated a shared leave pool. State employees can donate leave to be used when needed by foster parents. Washington also utilizes YouTube video therapy. DHR provides video links to therapy sessions as a resource to support the diverse needs of the children in care. Lastly, Washington created the Foster Parent 1624 consultation team. This is a team of subject matter experts, caregivers, community leaders, and legal counsel that come together to discuss problems and solutions roundtable style. Based on our research of Alabama's foster care system and other states' procedures, we would like to propose the following recommendations. Develop a foster parent consultation team, similar to the current 1624 team convening in Washington State. This team would conduct roundtable meetings with foster parent representatives, agents from the Foster Parent Association, DHR, staff, and community and legal leaders to discuss issues of a statewide concern for foster parents. This would allow each facet of the foster system to have a voice in which recommendations can be offered to improve the system. Alabama does have a health packet that is to be filled out prior to child placement. To further develop this resource, we recommend establishing a database for foster children's health records accessible to the foster parent and health professionals, similar to Texas. By having access to this information, it can give providers the opportunity to reduce medical errors due to missing information or a young child's inability to effectively communicate. This recommendation could result in a cost-saving benefit to the state due to a reduction in testing and duplicate testing, immunizations, and prescriptions. Another resource recommendation is to expand the current resources list on the DHR website to include 2 critical resource lists, one for agencies and one for family support. A great example of the suggested resource list is included on the Arizona website. The hope of the State Department is that with ongoing and recurring training and development, Alabama's foster parent and adoption numbers will continue to rise for the children in need of temporary or permanent homes. To help with this need, it is our recommendation to include an option for web-based training in order to help the prospective foster families receive licensing in a timelier manner. So foster parents can better assist their foster children with challenging behaviors, we also recommend the use of YouTube video therapy, which is currently being used by Washington State. All the above recommendations will be contained on the recommended communications and training portal on the DHR website. As a way to improve communication between a county's DHR and the community, foster families and potential foster families, we recommend each county develop and maintain a public web portal or a portal within the DHR website. This public page would be a way for DHR to distribute information to each community. The children entrusted to the state of Alabama's foster care community are fortunate to have such a committed group of people ensuring their temporary or long-term care experience is adequate and safe. Building better channels of communication, resource system, and providing appropriate and easily accessible training for foster families can only enrich the foster care community for the foster children in Alabama. In closing, I would again like to thank you for taking your time and joining us this morning, and I would like to leave you with this quote. We do not need to know the beginning of a child's story to change the ending. If you would like more information on the foster care in Alabama team, please visit the website aum.edu/CPM. Thank you.
Good morning. Thank you for joining our CPM webinar. My name is Keosha Jones-Shuford. I work for the Alabama Department of Finance, and today I will be presenting Caring for Alabama Elderly's research, recommendations, and findings. First, let me start by introducing my team members. From the Alabama Department of Revenue, Carl Carter, Mia Leroy, Lauren Montgomery, Jennifer Reynolds. From Alabama Department of Youth Services, Connie Rich. And from the Retirement Systems of Alabama, Susan Traum. Our team objective today is to identify and offer recommendations on how we can improve the long-term services that are available for Alabama's elderly population. With the ever-rising cost of healthcare, it is imperative that the elderly population have the proper care needed to maintain the quality of lifestyle that they have. In order to identify how we can better care for our elderly population here in Montgomery, Alabama, we use the 2017 AARP Long-Term Services and Support Scorecard. This scorecard has been done by AARP for 3 years, 2011, 2014, and 2017. On each scorecard, they rank the states based on how they care for the elderly and the caregivers that are caregivers for the elderly. They use 5 dimensions for these measurements. They are affordability and access, choice of setting and provider, quality of life and quality of care, support of family caregivers, and effective transitions. On the 2017 scorecard, Alabama ranked number 49. They have consistently been bottom ranked on all three of the scorecards. And the chart illustrates how most of the bottom ranked states are concentrated in the southern part of the United States of America. For this project, we looked at Dimension 2, which was choice of setting and provider. In Dimension 2 for choice of setting and provider, it encompasses 6 indicators. Those indicators measure Medicaid funds used, subsidized housing, the availability of housing, and also nursing homes and home health care aides. Alabama is again in the bottom quartile, ranking 51st in choice of setting and provider for Dimension 2. The first indicator is Medicaid and state spending on home and community-based services. This indicator evaluates how many Medicaid and state dollars are spent on keeping the elderly in their home and in community-based services as long as possible. For this project, we compared Alabama to Minnesota, Missouri, and Louisiana. Minnesota and Missouri was compared because they have consistently been ranked in the top percentile. Louisiana was compared because it was a southern state that when the scorecards began was in the bottom and has moved to mid rankings. Minnesota, which is number 1, spends 68% of their Medicaid and state funding on the elderly to keep them in their home as long as possible. Alabama was ranked in the bottom percentile, and they're only spending 14% of Medicaid and state dollars for home and community-based services. Indicator 2 is new Medicaid beneficiaries receiving home and community-based services. This indicator evaluates how many of new Medicaid beneficiaries are first receiving services in their home instead of going to a nursing home. Out of the 50 states, 29 have improved significantly in this category. But as you can see, Alabama declined performance and they were ranked 49th. Minnesota, which is number 1, 80% of their recipients first receive services in their home. Alabama, again, which is 49th, only 30% of their recipients are first receiving services in their home. Indicator 3 is participant-directed services. A participant should have the right to choose how and why they receive services, where they receive them, and who gives those services to them. This model allows the individual to set the rates, also set the person's hours, and set where they receive the services. Participant-directed services has seen a 143% increase over the 3 scorecards. When they began the scorecards in 2011, there were 740,000 participants. In 2017, there were 1,058,889 participants. Out of that million plus participants, Alabama only had 260 participants, which ranked them 51st in participant-directed services. Indicator 4 is home and health personal care aides. With the elderly population wanting to stay in their home longer, home and health care personal aides are needed to care for them when they can't do certain tasks for themselves. Alabama ranked 49th. They only have 12 personal care aides per every 1,000 elderly population. Minnesota is ranked number 2. They have 49 personal care aides per 1,000 elderly population. The Bureau of Labor Statistics has said that by the year 2024, the demand for personal care aides will increase by 64%. Alabama is already lagging behind, so they have to find a way to meet that demand. Indicator 5 is assisted living and residential care. Minnesota again is ranked number 1. Medicaid dollars can be used to pay for assisted living and residential care. Their median income is $70,000 and the average cost of assisted living is $48,000. Alabama ranked 51st. Medicaid dollars can only be used to pay for residential care, which is your nursing homes. Medicaid dollars cannot be used to pay for assisted living. And with a median income of $49,000, it's hard for any individual to be able to afford assisted living averaging $39,000 a year. Indicator 6 is subsidized housing. This is the only indicator in Dimension 2 that Alabama has excelled in. Alabama ranks 13th. Although Alabama is excelling, there is still a subsidized housing crisis. The demand is far exceeding the supply. However, Alabama cannot just put up units to have a high number. They must consult with state and local officials to make sure that the units are designed for the elderly and in areas that are utilized more frequently by the elderly population. After researching the data, the problems that we found for caring for Alabama elderly is insufficient funding for home and community-based services. Research has shown that 90% of the elderly population prefer to stay in their home. So we need more funds allocated here. We're only allocating 14%. Medicaid funding cannot be used for assisted living facility. And our third problem was a lack of Medicaid funding available for services for the elderly overall. Our recommendations to combat those problems is to increase funding to our home and community-based services by way of Medicaid waivers and managed care programs. Currently, Alabama offers 14% of their Medicaid dollars to be used for home and community-based services. By increasing Medicaid waivers, we can offer more money to be used in the home and community-based field. Provide Medicaid funding for assisted living facilities. Assisted living facilities are one of the fastest growing type of senior housing. Alabama is one of 6 states that do not allow any type of funding to be used. It is imperative that they model the 44 other states and allow Medicaid funding to be used to help with assisted living facilities. And our last recommendation is to adopt and implement Medicaid expansion, also known as the ACA Act. The U.S. Government and Accountability Office has studied and showed that states that have expanded Medicaid and used it to increase their eligibility and enrollment have improved the quality of life for their elderly and for rural populations. The Alabama Hospital Association has said that if Alabama was to adopt and implement Medicaid expansion, that in the year 2023, there would be a $61.8 million revenue increase. This will free up state dollars because federal funding will be coming in. Those additional dollars that are free can be used to combat other funding issues with the elderly as far as Medicaid and funding for assisted living facilities. In conclusion, it is imperative as the baby boomer population is nearing their retirement age that we increase the quality of care for our elderly population. We have given you some recommendations. Although there are no easy fix, those recommendations can be used to aid Alabama in changing the way we see our elderly population. I'll leave you with a quote by author Tia Walker: "To care for those who once cared for us is one of our highest honors." If you need more information on caring for Alabama's elderly, please visit the CPM Solutions Alabama website and read our white paper. Thank you for your time, and thank you for visiting our webinar today.
Thank you, Kiosha, and thank you to our 4 presenters who did such an excellent job today informing us about these important issues facing our state today. As you listen to these 4 presentations today, I hope that you leave encouraged by some incredible services that our state is providing our citizens as it relates to these 4 topics. If you think about liquor distribution in the state of Alabama, I hope you're encouraged in knowing that the state of Alabama has a very highly profitable model that benefits citizens across the state in a powerful way. And as you think about the other topics as well, foster care in Alabama, food deserts in Alabama, and caring for Alabama's elderly, there's no doubt that we all know individuals who are impacted by these topics, and we're very grateful for so many state leaders across our state that are already providing tremendous services to help those that are impacted by those particular issues across the state. And as we close our presentation today, I hope that as we leave and we think about Solutions Alabama, I hope that we all, want to encourage those who are working in public service, but also that we would also want to be a part of being part of solutions for not only these particular issues that we've talked about today, but every issue that impacts our state. Thank you again for those who joined the webinar today. I want to encourage those who are interested, perhaps you yourself or someone that you know, who could benefit from the Certified Public Manager Program for the state of Alabama. Registration is open now, and it's going to be open through the rest of the year. actually through mid-January. We're going to start the 2021 class in February of next year. So if you know someone who would like to benefit to strengthen their leadership skills through this program, visit us on our website, aum.edu/CPM. You'll see a lot of information there. I would also enjoy talking with you to inform you more about the CPM program. Thank you all again for joining today's presentation and for, as well, your support of the CPM program. And we hope that you have a great weekend. Thank you again.